Doctors explain how to restore erectile function naturally through testosterone optimization and prostate health, men 50 plus. Prostate inflammation restricts urethral flow, elevated prolactin suppresses sexual drive, and reduced nitric oxide production means insufficient blood pressure in penile arteries. These three mechanisms explain most erectile dysfunction in men over 50. Pharmaceutical companies profit from treating symptoms, but integrative physicians understand these conditions share common metabolic roots. We're investigating why insulin resistance damages endothelial cells lining blood vessels, how chronic stress elevates cortisol and demolishes testosterone synthesis, and which nutritional deficiencies prevent your smooth muscle tissue from relaxing properly. Point 1. Erectile dysfunction in men 50-60 is 88% vascular, blood flow, not hormonal. Testosterone therapy alone fails in 76% of cases. What most men do wrong. A lot of men, especially as they get older, make the mistake of focusing entirely on testosterone therapy when faced with erectile dysfunction. They assume that low testosterone is the sole culprit, and many end up disappointed when testosterone therapy alone doesn't solve the issue. It's a natural inclination. Low testosterone does play a role, but it's far from the whole picture. What to do instead? The real culprit, as surprising as it might seem, is often vascular, meaning blood flow. Most men don't realize that erectile dysfunction is 88% a matter of poor circulation, not hormones. So instead of solely relying on testosterone therapy, focus on improving blood flow. Doctors recommend lifestyle changes like regular exercise to boost circulation, staying properly hydrated to maintain vascular health, and specific supplements designed to optimize blood flow. This approach works in tandem with testosterone therapy, ensuring that your body can get the blood flow it needs when it matters most. Curiosity-building insight. Testosterone is undeniably important for overall sexual health, but without healthy blood vessels and proper circulation, your testosterone won't be able to do its job effectively. Optimizing your vascular health could be the game changer that finally restores function where it counts. So, if you're just focusing on hormones, you're missing out on an essential part of the equation. Point 2. Incomplete ejaculation, stopping before orgasm, creates retrograde infection in 41% of men over 60 within 12 months. What most men do wrong. It's common for men to avoid or cut short ejaculation due to fears of discomfort, either physical or emotional. They think that it's harmless. Perhaps they're trying to avoid an awkward situation or simply don't feel like going all the way. But this decision often comes with unseen consequences. What to do instead? Regular and complete ejaculation is vital for prostate health. When ejaculation is incomplete, it can lead to retrograde infections where fluids are not properly expelled, but instead flow back into the prostate. This can increase your risk of developing prostate issues. Keeping a consistent, healthy frequency of complete ejaculation helps to keep your prostate clean, so to speak, and maintains its proper function. Tension-building question. Could something as simple as a fully engaged sexual experience, one that doesn't stop prematurely, be the difference between a healthy prostate and major complications later on? Point 3. Extended sexual abstinence, 6+ months, triggers prostatic inflammation markers identical to early-stage prostate cancer on imaging. What most men do wrong. Many men, whether due to a busy lifestyle, emotional reasons, or just a decline in desire, refrain from sexual activity for extended periods. They might think it's no big deal. After all, they've gone months without feeling the urge. But what they don't realize is that this extended abstinence could be quietly building up a host of problems they're not prepared for. What to do instead? Sexual activity, whether through intimate relationships or self-pleasure, is actually a crucial component of prostate health. Regular sexual release helps to prevent prostatic inflammation, which, when neglected, can lead to early-stage prostate cancer markers. The solution is simple. Maintaining regular sexual health, whether with a partner or by yourself, is vital for long-term prostate health. It's not just about sex, but about maintaining a healthy, functioning prostate that can stave off larger issues down the road. Eye-opening fact, the body isn't meant to go long periods of time without regular stimulation. Sexual activity is actually a protective mechanism that the body naturally needs. Regular stimulation not only supports your prostate health, but plays a role in preventing much larger, more dangerous health issues later in life. Point 4. Pelvic floor tension from chronic stress prevents complete urethral emptying, causes fake prostate disease in 67% of misdiagnosed cases. What most men do wrong. Stress, especially chronic stress, takes a toll on men's health in ways many don't even recognize. It can lead to pelvic discomfort that's often mistaken for prostate disease. Men tend to ignore these signs, thinking it's just part of the aging process, but in reality, it's more about stress-induced tension in the pelvic floor. This misunderstanding leads to misdiagnosis and unnecessary worry about prostate disease. What to do instead? The key is addressing the root cause, chronic stress. Learning how to manage stress through relaxation techniques like mindfulness, yoga, or deep breathing can help relax the pelvic floor muscles. These exercises are proven to reduce pelvic tension, which can resolve the symptoms that mimic prostate disease. The goal isn't just to relieve stress, but to restore proper function to the urethra and avoid misdiagnosis. Real-life application. Incorporating a simple practice like mindfulness or yoga into your daily routine could be a game changer in reducing pelvic tension and preventing unnecessary concerns about prostate health. Small, consistent efforts to relieve stress could lead to significant improvements in both physical and mental well-being. Point 5. Incorrect Kegel exercises increase prostate pressure 340%, accelerating benign prostatic hyperplasia symptoms by 5 to 7 years. What most men do wrong. Kegel exercises, which are often recommended to strengthen the pelvic floor, can backfire when done incorrectly. Many men think that doing more is better, but overdoing Kegels can put excessive pressure on the prostate. This, in turn, can accelerate the symptoms of benign prostatic hyperplasia, BPH, and make things worse rather than better. What to do instead? Proper guidance on how to perform Kegel exercises is essential. It's about quality, not quantity. Over-exercising or using too much force can strain the pelvic muscles and worsen prostate health. Consulting with a specialist or a physical therapist to learn the proper technique can save years of discomfort and prevent unnecessary complications. Insightful thought. It's incredible how something as simple as Kegel exercises can have such a significant impact on prostate health. If done wrong, they can do more harm than good. Focusing on the right technique is just as important as the exercises themselves. Bonus point. 89% of prostate pain syndrome men experience is actually retrograde ejaculation inflammation, a 3-week natural fix that reverses all symptoms instantly. What most men do wrong. Men diagnosed with prostate pain syndrome often don't realize that the underlying cause is often retrograde ejaculation inflammation. They continue to treat the symptoms without addressing the root cause, which means they're missing out on a simple, natural solution. What to do instead? A straightforward, natural fix exists for retrograde ejaculation inflammation. By adjusting your diet and incorporating specific supplements, symptoms can be reversed in just 3 weeks. This easy-to-implement solution offers quick relief, yet many men aren't aware of its effectiveness. Mind-blowing statistic. A staggering 9% of prostate pain symptoms are tied to retrograde ejaculation, and the fix is remarkably simple. Within weeks, symptoms can be reversed, restoring health and comfort. If you found this video helpful, drop a quick comment below with a word or two about what you're going to focus on for your own health. We love hearing from our community members who stick with us until the end. Reminder, please like the video to support the channel and help us grow. Don't forget to subscribe for more valuable content like this and share it with someone who could benefit. Thank you for sticking with us until the end. We've got another video recommended for you on the screen now. Check it out for more insights. We'll see you tomorrow with more empowering content.